3, 2, 1. Please start, sir. We are live.
Hello, good evening, everyone, and it's a great pleasure to welcome you all on this exciting clinical updates in the management of head and neck cancer, which is done under the aegis of Cancer Research and Statistic Foundation, supported by Fortis Hospital. It's a pleasure to welcome the convener, Dr. Vivek Belathur, sir, consultant medical oncologist at Fortis Hospital, Bengaluru, and I think everyone carries the greetings from the Garden City, Bengaluru. So good evening, everyone. Once again, sir, over to you, Dr. Vivek, for your welcome and introduction, please.
Thank you, Tarun. Once again, I welcome all of you to this evening's program. So I'm Dr. Vivek Belathur, consultant medical oncologist at Fortis Hospital, Bannerghatta Road, Bangalore. So welcome again. So for this evening program, we have this webinar on clinical updates in head and neck cancer, which is done in association with Fortis Hospital. So I would like to thank Dr. Rahul Sutsa first, who has helped us plan this scientific meeting, which is very important. Without whose guidance, and encouragement, this wouldn't have been possible. Thank you, sir. And I would also like to, welcome our other scientific committee members, Dr. Munish Gairola, who is radiation oncologist from Delhi, Dr. Surendra Kumar Dabas, surgical oncologist from Delhi, then Dr. Rajendra Kumar, radiation oncologist again, Dr. Sajjan Raj Purohit, medical oncologist, Dr. Chandra Gowda, all from Delhi, and Dr. Bharat Vaswani from Hyderabad, medical oncologist, Dr. Rajat Bajaj from Delhi, Dr. Venkatpati Babu from Assam, Dr. Advaita Gore from Mumbai, Dr. Naresh Somani from Jaipur, and not by the least, Dr. Vikas Talreja from Kanpur. Thank you all for joining this evening. So I think it's some time since we discussed head and neck cancers, which are so important for us in this part of the world, Indian context. We have, I think, one of the most common malignancies as far as head and neck cancers are concerned. I think nearly 30% of our cancers, our cancer burden is head and neck cancers. We somewhat tend to discuss on all other important cancers. Less often this has been, we discuss on this topic. So I think it's very important that we discuss more on this because there are a lot of unmet needs as far as head and neck cancers are concerned. So there are three important aspects to head and neck cancer as far as newer developments are concerned. One is the immunotherapy. As we know that immunotherapy is being used in recurrent metastatic head and neck cancers now. Now it's moving up to localized recurrent situations, and probably in some time it may come to adjuvant and neoadjuvant situations. That is one, and we already have this anti-EGFR monoclonal antibodies in head and neck cancer, which are used in recurrent settings and rarely unsparingly in non-metastatic settings, cetuximab. So we also have other molecules, nimotuzumab, which is like a kind of Indian drug, Indian molecule, which has been developed and also being tested through various trials in Indian subcontinent, and of course other countries are also doing trials now. And with an interesting data in nasopharyngeal cancer, which is coming from China recently, I think again we are kind of looking at it again for head and neck cancers. And then and the third important is the HPV positive cancers versus negative. This has been like going on for many years now, although it is as of now considered prognostic and not helping us with the treatment. I think going forward in some time, probably we will have clear-cut differences in terms of treatment as far as HPV positive and negative cancer is concerned. As we know that there is already now staging. Staging has come, TNM staging for negative and positive tumors, HPV positive and negative tumors, which is quite different as far as the staging is concerned. And also this evening we are discussing some of the interesting paper presentation at recently concluded ASCO, which is I think very important because these are the papers which help us understand and shows light for future developments in this particular tumor scenario. So and I think we have very good mix of oncologists today, medical, surgical, and radiation to discuss on all these important aspects. So I think so it's going to be very exciting meeting, and with a lot of discussions on these important topics. So to start with, I think I'll welcome the first speaker of today's evening program.